My name is Marvella Ford. I'm the Associate Director of Population Sciences and Cancer Disparities at the Medical University of South Carolina Hollings Cancer Center, where I'm also the Director of Community Outreach and Engagement. All four of my grandparents had died before I was born, so I never got to meet any of them. No one in the family could tell me how my grandparents died, just that they got sick and died. That really lit a fire in my spirit to focus on health equity and to develop strategies to improve health outcomes for populations of color.
One of the issues here is that we have a very large population of underserved and minority folks, and their outcomes when they do get cancer tends to be much worse than other components of the population. We are an NCI designated cancer center, the only one in the state of South Carolina. So one of our goals because of that is to tend to that population and make sure we understand why those outcomes are worse and what we can do to improve those results.
We're working with partners across the state to develop and test strategies to increase access to cancer care.
Dr. Ford's work is visionary because she has gotten the idea of actually partnering MUSC with South Carolina State University and bringing the research to the investigators and the students at that institution.
We share a biobank with them so they have samples that they can do studies on at their own university.
They're going to take research in a direction different from what investigators here at MUSC would, and we need that kind of diversity of thought when it comes to tackling these kind of problems in cancer research.
We're planting seeds of knowledge in the community. We're also planting seeds in our students who are now studying health disparities and really carrying the torch to find strategies to improve health outcomes for all populations.
I didn't really know anything about health disparities. You hear about it, but you really don't know about it. And Dr. Ford was able to acknowledge what it was, how it affects me, and how it affects everybody else.
With South Carolina Cadre, the Cancer Disparities Research Center, we conducted interviews with community residents, community leaders, to better find out about the needs, about the topics of cancer research that they wanted to find out about, but also to promote clinical trials.
A really good example of a success story is with our HPV vaccination program, because when we started it several years ago, we were the least vaccinated population in the country. And now, because of those interventions and teaching and education and outreach, we're now right up with the national levels, and we want to go even higher to prevent as many cervical and oral cancers as possible.
Our community partners helped to inform the agenda, and so the community members told us that people in South Carolina needed to know more about cancer. And that's how we really developed the Moving Up program, which is a Train the Trainer cancer education program. That program has allowed us to go out throughout the state with churches and other organizations to deliver an evidence-based cancer education training program that covers modules on prostate cancer, on breast cancer, colorectal cancer.
Church is a great place to start because the Black church in particular has always been at the center of the Black community.
Dr. Ford's project gives us a chance to talk to each other with truth. I've had prostate cancer. My daddy died from it. My brother's had it. And what this program can do is help you save your life and the life of people you love, because now you can talk about it freely, and stories is how we really get people to understanding it's them too, it's human.
We're really excited about all of the work that we're doing and seeing the impact in our state. And a direction that we're moving in is linking the social determinants of health with biological markers. Dr. David Turner is becoming nationally renowned for his work with ages and cancer.
We have the age reader, which is right here. It's a small little unit. So basically these advanced glycation end products, they're reactive metabolites that build up in the body, and they're also in the foods that we eat. So especially the unhealthy foods, the processed foods, high fat, high sugar. And these ages they sort of fluoresce, they glow in the dark, so to speak. So if you fire a laser at that certain wavelength that they glow, this machine can read it. So you just put your arm and it can measure that glow within the skin, and that's reflective of the number of ages that you have in the body. So then we can take that measurements and then look at people that have cancer, people that don't have cancer, and we basically find that the people with cancer have higher ages when we use this reader.
And all of the work that we're doing with our community outreach and engagement activities and building community outreach and engagement into our research projects and linking the social determinants of health with cancer outcomes and with inflammatory biomarkers, and trying to increase physical activity in the work that we do with our community partners. All of those activities combined are designed to increase both the lifespan and the quality of life of the people in our communities.